Good morning to you, to Raul, who is accompanying us from the studio, and to all our audience who follow us every morning, including Sundays. We always know that it is a little more difficult to get up early on Sundays. We'll begin the information with the unpleasant news, conveying our condolences to the family, friends, for the death of an 85-year-old female patient from Villa Clara. She was admitted in the military hospital that had already been reported as critical. She was a contact of a confirmed case and had a history of peripheral venous insufficiency. After a stay of 17 days in the hospital, 12 in intensive care, and despite all the efforts made by our professionals and technicians, starting on day 12, it was necessary to keep her in mechanical ventilation. She made a group of complications, and unfortunately she suffered a cardiorespiratory arrest, and it was not possible to revive her, and she died. We reiterate our condolences in relation to the death of this lady. To date, 585 patients remain admitted in the hospitals in Cuba, 416 suspected, and 168 confirmed. Note that these figures are lower than in previous days, and it's logical. And 1,704 people are being monitored in the primary health care system. This figure includes people who are discharged from hospitals or are some contacts who have already been released, but nonetheless they are still under surveillance in primary health care until the established period has elapsed. This morning, we made some clarifications with the Health Surveillance Center of the Ministry of Public Health, a very professional team, very technical, that works round the clock. It processes all the information we provide here, and they clarified that in the travel centers, which was a question that was raised yesterday, there are 474 newly arrived travelers. Remember that there has been, and our media have been reporting on it, there has been arrival of a group of people from abroad, a large number of Cubans who were stranded abroad, and that all those people, as soon as they arrive from the airport, they are transferred to their territories, but they go to an isolation center for 14 days to see if the symptoms appear and to undergo all the necessary tests. Yesterday, 1,431 samples were studied to diagnose SARS-CoV-2 and COVID-19. The laboratories of molecular biology of the Institute of Tropical Medicine processed 467, the laboratory of the Provincial Center of Hygiene, Epidemiology in Havana, 375, the laboratory of Villa Clara, 266, Santiago de Cuba, 141, and the laboratory of the Brother Ameijeras Hospital, 182. As a result of analysis of these 1,431 samples, 10 tested positive, representing 0.69% of the samples processed yesterday. In this way, Cuba accumulates 94,060 analyzed samples. Some of them, 1,941, have been positive. That is 2.1% of the analyzed samples. And let me clarify, as a result of several questions from the population, let me clarify that these 1,941 are people. 1,941 people with COVID-19 that do not repeat. There are people who have the test repeated, who sometimes test positive again and it is repeated. But these are not counted as new cases, but rather that there are 1,941 people who have been confirmed in our country. Of the 10 cases that were confirmed yesterday, all of them are Cuban. And this is how it has been happening in the last few days. 9 are contacts of confirmed cases. And in this way, 1,699 have accumulated. 89.4% of the people who have been diagnosed in our country are contacts or have had contact with some confirmed case, which is the main group at risk. We have one person with a source of infection abroad, and thus 132 of the 1,941 persons who have been confirmed have their source of infection abroad, which is 6.9%, in which they have had contact with a foreign country or with a person who has come from abroad. Yesterday, the source of infection for all patients was not specified. However, in all the epidemic, there are 69 cases, 3.7% where the source of infection has not been established. The highest percentage of the cases, 8, that is 80%, are female, and 953 have accumulated, 49.1% have increased, and are equal to the male sex. And yesterday, 2 of them were male, and 988 have accumulated, that is 50.9%. 60% of the cases, 6 were asymptomatic. And we can say that in our country, 973 of the 1,941 confirmed cases were asymptomatic at the time of diagnosis, which represents 50.1% of those confirmed to date. By age group, the most affected was under 40 years of age with 5 cases, followed by the group of 40 to 60 years old with 3 cases. Yesterday, a 6-month-old child from the province of Matanzas was confirmed in the under 40 years group with a positive case with a favorable clinical diagnosis. And so in Cuba, 197 children have already been diagnosed with COVID-19, of which 178 have already been discharged. And I reiterate that their evolution has been favorable because of the great care that has been taken due to the delicate nature of their age. By provinces, there are 5 cases which are from Havana, 2 from Centro Habana, 1 from Habana Vieja, 1 from Arroyo Naranjo, and 1 from Boyeros. From Matanzas province, there were 4 cases, 3 from Matanzas municipality, and 1 from the Jovellanos municipality. And in the case of Granma, a province that has not been confirming cases for several days now, there is 1 confirmed case that is from the province, from the municipality of Giza. Now, this is a case of a Cuban nurse who was on a mission abroad, who returned 3 days ago, and as soon as she got back at the very airport, our specialists detected she had some symptoms, and she was transferred directly from the airport to the Pedro Curie Institute of Tropical Medicine for admission. This is a patient who is counted in Granma province because she's from Giza. So these are epidemiological peculiarities, but I know that they do have a repercussion. She has not been in Granma. She went directly from the airport to be admitted at the hospital, and therefore we cannot say that in Granma province the history it has been accumulating of negativity has been lost because of this situation. We should say that out of the 1,941 patients diagnosed in our country, 168 remain confirmed. These are the active cases we had until last night at 12 o'clock. Of these, 165, 98.2%, and this is the highest number we have ever had, has kept a stable evolution. This is an important achievement resulting from the treatments, the care, and the early diagnosis. Nevertheless, we regret the death today of the patient, and with this we have accumulated 82 deaths as a result of COVID in our country, which gives a lethality of 4.22%. And in this way, Cuba remains in the 15th place in the region of the Americas. The lethality in the region stands at 5.82%, and of the 35 countries belonging to the region, 12 have lethality rate higher than the average of 5.92. Cuba falls below, and it's consequently is on the 15th place. We always report about the two evacuees, and on the day there were 18 discharges. Another day that as a result of the actions and treatments, we have more discharges than confirmed cases, 18 discharges and 10 confirmed cases, and thus 1,689 patients are reported to have recovered. That is 87% of the patients who have been diagnosed with COVID in Cuba have already recovered, and they are now discharged, some still under home restrictions, and others incorporated into their activities. Today we are reporting 3 patients in serious condition. Of the 3 confirmed serious patients, 2 are at the Salvador Allende Hospital in Havana and 1 at the Mario Muñoz Monroy Military Hospital in Matanzas. The world, 185 countries have cases of COVID-19. And I was watching on Telesur and other media that yesterday 107,897 cases were confirmed, and the world already has an accumulated of 5,175,476 confirmed cases. As you can see, the number of cases is not decreasing, and the figures are very alarming. Yesterday, 5,328 people died with COVID-19. And there are 338,039 deaths in the world, and that gives a fatality rate of 6.53%. Turning to the region of Americas, 60,333 cases were confirmed yesterday, and 2,365,427 cases are accumulating. 45.7% of the total number of cases reported in the world. In the region of the Americas, 3,235 people died, and 139,960 accumulated deaths for the region, for a lethality of 5.92%. We can say that the situation in the world, in addition to the very complex situation in the African continent due to the difficulties there in some of these countries in terms of resources, structures, health systems, difficulties among the population. But we can say that Brazil, already in the region of the Americas, has been increasing the number of cases and deaths. And in the table of positions of countries with the highest number of cases, Brazil has already displaced Russia, that had remained in that place. In the case of Chile, and there you can see the table of countries. It's a little bit small, but you see Brazil in the second place, higher than Russia with the countries in terms of confirmed cases. In the case of Chile, it has displaced Belgium, and this is another country that is increasing the number of cases and the number of deaths. And 7 countries in the Americas appear among the most affected in the world. And we have heard in some of the news that Brazil is becoming the epicenter of the pandemic in the region of the Americas. This is the information we had for today's briefing.